Reducing pain when bending the knee. As long as you haven't had a knee replacement and your surgeon has said you need to avoid bending on your knees at all costs, most people use bending the knee to get down onto the ground and to do things like gardening, weeding, playing with the kids, reaching something from underneath an object such as the couch, or dusting, mopping. There are occupations that require you to be on your knees. So if you've got pain with bending your knees, you want to know what's going on. Is it serious, and how do I treat it? First of all, let's break it down to the anatomy. The most common area that's going to have pain when you're bending is that of the Penhollow or kneecap, femoral or long bone of the thigh area. So that's that front of the knee. That's the most common area to get pain when you're bending, because when you bend down, that's what puts stretch on this area. So we've got a whole bunch of things in this area that could be inflamed. More likely, pain with bending the knee is coming from a bursitis. We don't have bursa on this model. These are more of the hard surfaces. But bursa, think of them of like little silicone jellies. They can be as tiny as this, as large as this, and they are located in different areas. We've got one before the patella called the prepatellar. We've got one around the femoral, the suprapatellar area. We've got some for the bursa, such as the pezanserine bursa, the semitendinosus bursa. We've got bursa in the back of our knee. So those bursa job is basically to cushion, kind of like having your very own little gel packs. But if we get inflammation, those bursa can become inflamed, and that's called bursitis. Bursitis typically goes away on its own. However, if left to its own device and the agent that is causing it is not stopped, like you're doing the same repetitive thing over and over. For example, somebody's putting down carpet and slamming the knee into the tool that helps put that carpet down to the corner of the wall, then you're going to continue to have that bursitis and the inflammation that just remains. So if we can cool down the offending agent and we can rest, then we can start to look at why did it happen in the first place? Because we want to get to the root cause so it doesn't keep coming back. Very often it is that we've got some tight muscles. Those tight muscles, for example, quads, can push down on the bursa, therefore kind of making it squish. And with the motion of the quads, then it can become inflamed, kind of like rubbing over and over like a friction rub. If we've got malalignment, say that we've got knock knees or we've got bow legs and our patella kneecap is not tracking perfectly within this little groove here, it's coming more off to the right or off to the left, then we can get a friction point there and the bursa gets inflamed. So making sure that we have symmetry of the muscles on either side of the thighs, the medial aspect called vastus medialis quad, the lateral aspect, the outside called vastus lateralis quad. So specifically training those, going to physical therapy, perhaps using KT taping to help keep that knee cap in alignment while you strengthen is something we use often. Other things we look at in an acute inflammation status would be it's hot, it's inflamed, it's not happy. Ice is your friend. Ice, not directly on the skin, but maybe through a piece of cloth like a thin t-shirt. It can be a rag, placing a moldable ice pack such as a bag of peas, a bag of corn, and then just making that your ice pack. You're not going to eat it because it's going to defrost. You can put it back in the freezer and use it again later, but 20 minutes on, 20 minutes off at least. You could do that a few times while you're resting, while you're giving it a break and not getting in that position. Another thing to think about is, when does the knee pain with kneeling hurt? The moment you get on your knees, or is it only after you've been on your knees for a little while and then it's aching before you get up? It didn't hurt until then. It's not aching when you get up. It's just after you stand up and then you're stiff. And others would be, you didn't have any pain until you got up and started walking. So all of that can kind of point you in the direction of what is the cause of the knee pain. Something that you can do if the knee hurts while kneeling, you could actually add in a pad. They've got the kneeling pad so that if you are on your knees on a regular basis, that we're not having direct contact of that bony joint right on the ground. You can change the surface. So that's one thing. The warm up, that you can take some walks around, kind of warm up, get your knees full of good blood flow to the area. It's nice and loose. You can add some heat to the knees before you start kneeling. You can also do some quad stretches and some hamstring stretches, some lateral lunges from side to side to stretch out the inside of the knees and the outside of the knees, so that when you do get down on your knees, your ligaments and your muscles, as they attach to the bony aspects, can be nice and warm, less likely to give you some pain. So those are the most common reasons for knee pain with kneeling. Kneeling pain is mostly a bursitis, and bursitis comes from an overuse or a friction, and taking a rest, putting some ice, making sure that you've got stabilization of the muscles, supple of the muscles. They're nice and loose and warm and lubricated from you doing a warm-up is the best bet. Some people talk about utilizing the non-steroidal anti-inflammatories, the NSAIDs, such as naproxen, Motrin, ibuprofen, Aleve, aspirin, but not everybody can take those, particularly those who've had gastric bypass surgeries, those who've had bleeding ulcers, those who are also on very strong blood thinners, such as Plavix or warfarin or Eliquis or some of those. So if you can't use that, sometimes the topicals can work. Topical CBD creams, particularly come from the hemp plant, don't have any THC in them. Topical things such as Aspercreme, which is basically lidocaine. It used to have aspirin in it. It doesn't anymore. Topricin, many of the non-branded things that can kind of help with taking some pain away from that knee. Ice, heat, warm-ups. In general, it's not a big dangerous thing to have knee pain with kneeling, and it can typically be taken care of with a non-surgical approach, a comprehensive look at what's causing it and trying to avoid it in the first place. If you have any more questions about knees and knee pain, please leave it down below in the comments. Like and subscribe. I would love to hear what's going on with your knees. Thank you. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.